If you've seen some of my other videos, then you'll know that osteoarthritis is a common topic on my channel. Not only because it's a really common problem, but because I also have it myself, in my left hip joint. So in this video, I'm going to talk about the textbook symptoms and management of hip osteoarthritis, and I'll also share my own personal journey of discovery and what I now do to help keep my arthritic hip joint as good as it can be, and hopefully stave off that hip replacement for as long as possible, and hopefully forever. So I'm Stephen Bunting. I'm a specialist MSK physiotherapist working in the UK. Welcome to my channel, where I discuss the common MSK problems experienced by everyday people and the evidence-based insights to help you stay informed and healthy. If you're watching this video with very little knowledge about osteoarthritis, then I would urge you to first watch this video, which explains all about the condition in detail, and also this video, which looks at the question of whether osteoarthritis is actually a wear and tear condition, and therefore whether exercise can help. And I'll also put a link to both of those videos in the description. So we know that this is a degenerative condition. We don't have all the answers as to why some people get it and others don't, but we know that there are risk factors at play which can make someone more likely to develop the condition. And these include older age, family history, previous major trauma to the joint, being overweight, living a sedentary lifestyle, and having a poor diet, particularly one high in sugar, highly refined carbs, and highly processed foods. Any synovial joint can be affected by osteoarthritis, but it's most common in the hips, knees, the joints of the spine, the fingers, the thumb base joints, and the big toe. So with hip osteoarthritis, the classic textbook symptoms are a deep aching pain when walking and standing, mainly felt in the groin and sometimes the buttock region. Hip stiffness is also a common symptom, particularly first thing in the morning after getting out of bed, and also after being sat for a while. And then difficulties with activity like putting shoes and socks on, getting in and out of a car. And in more advanced cases, there might be a crunching or a grating sensation during hip movements, which is something that we call crepitus. But if you have isolated pain over the outside of the hip, just here, over that prominent bony area, then it's unlikely to be osteoarthritis, and much more likely to be a tendon problem called GTPS, which stands for Greater Trochanteric Pain Syndrome. I will get round to doing a video about GTPS, and when it's done, I'll put a link to it in the description. So my left hip has been giving me symptoms for over 10 years now. I get that classic deep groin ache, which can occasionally radiate into the front of the thigh, and on a bad day, I can sometimes even feel the pain as far down as the shin. And that's quite common when you look at the clinical studies into this condition. And when I've spoken to other people with it, they also experience this type of radiation. The pain is often there at a low level for most of the time, but it will feel worse after I've been sat for a while, especially in a low chair, and also first thing in the morning when it can take 5 or 10 minutes to loosen up. My pain is at its worst after activity, and especially after a long walk. One of my main hobbies is hill walking and hiking, and if I've been out all day on a long hike, it often feels okay while I'm out walking, but on the drive home it will start throbbing and aching. And then when I get home, and that drive might be only an hour or two, but I'm then struggling to get out of the car, and then I'm hobbling up the stairs like an old man. I then get in a hot bath, and that feels much better. Ibuprofen and paracetamol can also help. And then it can be a few days later before it's settled back down again to its usual background level. On a day-to-day basis, it's painful during bending and rotation activities, so things like twisting when stood on my left leg, when deeply squatting down, and also simple things like turning over in bed. The diagnosis is usually made based on having the classic symptoms that we spoke about earlier combined with some form of imaging, usually an X-ray or an MRI scan. Here is an X-ray of a normal pair of hip joints, and here is one showing moderate OA changes, and here is an X-ray showing severe OA changes. And while imaging can be helpful in determining the visual severity of hip osteoarthritis, it doesn't always follow that the degree of arthritis seen on imaging corresponds with the severity of symptoms. Over my career, I've seen people with X-rays like this that have hardly any pain. Indeed, I saw a working farmer in his late 70s only recently whose hip looked like this, but his only symptom was some stiffness that meant that he struggled to get in and out of the tractor. And conversely, I've seen people with severe OA hip symptoms and only mild arthritic changes on imaging. But it's the symptoms that dictate the treatment, not the X-ray or scan. Indeed, the farmer I mentioned needed no other treatment than just some simple advice about getting in and out of the tractor cab and some simple stretches. The general advice for anyone with hip arthritis is to first and foremost address any of the risk factors which might be relevant to you. Of course, you can't change your age or your genetics, but you might be able to lose weight and improve your general health and physical condition. Diet, in particular, is thought to be a major player in the symptoms of OA, but the reasons behind it are complex and not very well understood. Many clinical studies have looked at diet and arthritis, and the only clear consensus is to advise a Mediterranean-style diet rich in fresh whole produce and low in sugar, refined carbs and highly processed foods. But beyond that, the evidence is not clear on dietary specifics or supplements. And if you look down the comments of my other arthritis videos, and I'm sure this one will be exactly the same, you're going to see some people vociferously claiming amazing results from a particular diet. It might be a carnivore diet or a keto diet. It might be one which avoids certain food types. And there will no doubt be many comments suggesting some of the supplements like frankincense, glucosamine, boron or turmeric and ginger. And people ask me about diet and supplements all the time. And I'll tell you what I tell them. I honestly don't know. I can tell you that the evidence is lacking, but good quality studies haven't looked at all diets and all supplements. I certainly haven't tried them all. I eat a generally well-balanced, healthy diet, and that makes sense to me. I'm not prepared to eat unhealthy foods and see if my symptoms worsen, and because my arthritis symptoms are now currently under good control, I don't want to exclude anything I'm eating either. But it might be different for you. You will need to make your own mind up. The only advice I would give you is that if you are going to try a dietary change or introduce a supplement, then just have an open mind and be prepared to accept the possibility of a placebo response. Maybe keep a pain diary and look at your daily pain averages on a scale of 0 to 10 over at least 6 weeks before making any changes. Then, if your new regime is helping, then you should see a clear difference in pain scores over another 6 weeks. And if you're still not sure, then stop and see. If things aren't changing, then don't waste your time and money. The other self-help treatment, which can most definitely help with symptoms, is by introducing a regular program of activity and exercise suitable for your hip. And here, the clinical evidence is compelling. Numerous high-quality studies have shown time and again that regular exercise can help with the pain of arthritis, including studies that have just looked at hip OA. And so now I'm going to share with you my daily regime that I've changed and refined over the years to best help with my hip joint. It might not be right for you, but it should give you an idea as to what you can perhaps try and how to then adjust it to suit your needs. So before we get into the specifics, I will tell you that by far the most helpful exercise I do for my hip is walking. I know, not very exciting is it, but it's so true. By just walking for about 1 hour every single day, my hip feels so much better. I worked this out about 5 years ago when a friend suggested doing a challenge where we walk 10,000 steps every day through the month of March. Now, as I said before, I'm a keen hiker, but I might only go for a long hike once every few weeks or so. But it wasn't a regular thing. So the 10,000 daily steps was something I could physically do fairly easily. In fact, it was really more of a challenge in finding the time and also the motivation to go out in all weathers and get it done. But after the month, my hip had never felt better. And then, after my longer hikes, my hip wasn't aching so much on the drive home, and my painkiller use had dropped off significantly. At the end of the month, I intended to keep up the daily steps, but life got in the way, and although I was walking more overall, the regularity slipped, and sometimes 3 or 4 days had passed without me hitting my daily target. And before long, the aching pain had returned, and the painkiller use had started creeping up again. So a clear pattern had emerged. I then spent the next few years experimenting with the amount of walking that I needed to do, while still getting the benefits. Indeed, I walked an average of 10,000 steps every day for a full year recently. And after all of this, I came to the conclusion that if I managed somewhere between 5 and 10,000 steps every day without fail, my hip felt at its best. So some days I just managed about 5,000, which is about 35 to 40 minutes. And on other days, if I had more time, I managed the full 10,000 steps. But when I look at my monthly average, it worked out at about 8,000 daily steps. I still went out for the longer hikes every few weeks, but because I'd now built some resilience into my hip with walking, my hip could now cope much better with the hiking and didn't ache so much on the drive home and for those first few days afterwards. And indeed for me, if I could pick only one exercise to do every day, it would be just walking, because of that positive impact it's had on my pain and my mobility. But I don't just do one exercise, I do others as well, and I'll go through these with you now. So, I do some basic daily stretches and strengthening exercises. Nothing fancy, I do them all at home or at work with just basic equipment. So first up are a few stretches, and I tend to do these in the morning. I do 3. The first one is hip extension, and I just kneel on a cushion with one knee and then push my pelvis forward a little while leaning backwards with my upper body, like this. I hold the stretch for about 5 to 10 seconds and repeat 3 times. I then swap legs. I then do a variation where I add some spinal rotations and side bends like this, because it helps with my spinal flexibility. I then swap legs. The second stretch is a variation of the child's pose in yoga. I stretch out forwards in kneeling and tuck my knees as far into my chest as possible. I hold for about 20 seconds. I then come back up and repeat the same stretch, but with my knees a bit further apart like this. For the third time, I take my knees as far apart as I can while still being able to do the stretch fairly comfortably. This last position should feel tight in your groin area. If you can't kneel, then you could do a similar set of stretches in lying, like this. The last stretch I do is a rotation stretch in standing. I take my weight onto one leg and then rotate that hip fully inwards and then fully outwards like this. I stretch for about 5 seconds in each position and then repeat about 3 times for each leg. And that's it for my stretches. I would always try and keep these fairly pain-free. A slightly uncomfortable feeling in the end positions is fine, but you certainly don't want any intense pains or sharp catches of pain. Now for the daily strengthening exercises, and again I do just 3. They can all be done straight after the stretches, but I prefer to do them throughout the day when I've got a few spare minutes, often in between seeing patients at work. The single most important of these is the deep squat. I just squat down as deep as I can without pain. Keep your back straight and your feet flat on the floor. Don't go up on your toes. You can use a chair for balance if needed. I do 3 sets of 20 of these, and if I could only do one strengthening exercise to accompany my daily walks, it would be this one. It works the quads and the glutes, which are the most important muscle groups for the hip. If you're just starting this exercise, then at first maybe try 2 sets of 10 and don't dip too far. In this way, you create a manageable baseline level from which you can then slowly progress. The second strengthening exercise I do is the lunge. This is a great exercise as it mimics and then exaggerates the movements involved in walking. So the exercise is done like this. It's like taking a large step and then freezing for a few seconds before repeating on the other leg. I do 3 sets of 10 of these, and again, if your balance isn't so good, then you can do this exercise while using the back of a chair or a wall to hold on to. And the last daily strengthening exercise I do is one that really focuses on hip balance and movement control. So as you can see, I'm standing on one leg and I'm slowly leaning forwards until my hands touch the floor. I'm pausing for a second and then slowly coming back up again. I try to keep this as a nice natural movement, like I'm picking up something from the floor, but on one leg. I'm letting my knee bend comfortably to allow my hands to touch the floor. I do 3 sets of 5 of this exercise. Now if your balance is not quite that good, then you could just practice standing on one leg for about 15 to 30 seconds. And as you get better over the weeks and months, you could then slowly start to lean forwards. Or you could just use a chair or a wall for a bit of support if needed. Okay, so that's nearly my whole regime. The last thing I do is to add some resistance work, 2 or 3 times a week. I just use a dumbbell and basically do the same squat and lunge that I showed you earlier, but just with weights. So I do a goblet squat like this, using a 10 kilogram weight for 3 sets of 10. And I then do the straight lunge that I did before, but using 7.5 kilograms in each hand, and I do 3 sets of 10. You might need to use more or less weight in your case, or you might feel that the other strengthening exercises without any weight are quite enough for you, and that's absolutely fine. So that's my full regime: a daily brisk walk of about an hour, 3 daily stretches and 3 daily exercises, and then about twice a week I do the additional 2 exercises with weights. And my hip, which was classified as moderately arthritic on X-ray about 5 years ago, gives me minimal pain and allows me to do the things I enjoy, like playing golf and going on long hikes. So I hope that's been of value to you. Like I said earlier, this is a regime which I've adapted to suit me personally, and so if you do decide to do something similar, then you're probably going to need to adjust it to suit your needs and your capabilities. And if you're looking for a more generic general hip and knee arthritis exercise program, then you can check out this video right here, which I'll also link to in the description. Okay, well that's about it. Thanks very much for watching, take care, and bye for now.